Hi, it's Megan Johnson. This is blog number 3. Some of the leadership skills that I found in the Chapter 7 text. Planning is one of them. I already do like to plan. I've never done this from a manager position, but as far as a mom position in school and work, this has always helped me stay on track with goals. It's measurable. You can hit the small goals in order to reach the larger goals by having a set out plan. I would also research the past trends in staffing shortages, overstaffing, and the current acuity of the patients. These are all important in creating a smooth unit. I would also look at the past trends of the unit, because it can help prepare salary budgets when you're preparing for the shortages in staff. When there's new hires coming on, summer vacations are a big one, Christmas vacations, things like those. Staffing. The text described it as a complex skill that cuts down on under and overstaffing while still remaining flexible to individual needs, which is very, very complex, I feel. And that the importance of this would be looking at patient satisfaction. This has become such a big thing in the healthcare environment that I feel if you could show the organization that the patient satisfaction scores were higher at times of adequate staffing, then this would help secure the resources needed to continue having adequate staff and lower patient-nurse ratios. One of the other skills I learned about was coordinating, and I think this goes hand in hand with planning and staffing because it's used to assemble and synchronize people and activities in order to carry out objectives for the organization. And it also can prevent conflict and misunderstandings, which is all very important skill in management. As far as the leadership skills questionnaire, I resulted the highest in interpersonal skills, and then administrative. Both of those were in the high range, and then in the moderate range was the conceptual skills. And so with the highest score in interpersonal skills, this would allow me to get along well with others in negotiating for securing resources needed for staffing. I also had a high score in the administrative skills, and this refers to more like managing people and securing resources. I feel more like through paperwork and climbing up the ladder to get those resources through higher management. The moderate category I said was conceptual skills, and this refers to the creative thinking and problem solving and formulating processes from the manager position. And I feel that the conceptual skill set, it can be improved with practice and knowledge that can only be learned when you're in the managerial position. And that's when it's best learned, because then you're practicing it day in, day out. The article that I found for my published literature, it was a research article for developing an interdisciplinary team for palliative care services in acute care settings. Daly and Matzel participated in a program named ACE Project, which stands for Advocating for Clinical Experience, a transdisciplinary palliative care education program. And they found that all the participants in the study, physicians, patients, nurses, social workers, and spiritual providers, reported a higher level of job care satisfaction and patient care satisfaction. The ACE program took a stretched out staff of five physicians, all seeing palliative cases within the hospital, in addition to their personal patients. And they took these 5 physicians and changed the team to consist of specialized physicians, 2 social workers, 2 chaplains, a pharmacist, and several end-of-life nursing consortium registered nurses. They also developed some tools to use, such as physician order sets, palliative care progress notes, social work and spiritual assessments, patient brochures, and a web page, all to help support this program for the palliative care services. I think having specialized interdisciplinary teams is a beneficial resource, but a lot of times the financial limitations of an organization can hinder this. Daly and Matzel concluded that the interdisciplinary team was able to identify and address any palliative care concerns early in the acute care hospitalizations being that they had a process already laid out and they met on a daily basis to discuss each of the patients, which led to a higher quality of care for the patients and their families. Let's see. The levels and departments that I would need to work in order to be effective in my role as a manager. I feel that in order to be effective within the role of manager, you need to have worked in the position that you are managing. I don't think it's easy to go in and manage a position that you have not personally been working, so you don't know the ins and outs of it, and you don't know what your staff is going through. And I also feel like your staff respects someone more if they know that you have been in their position doing their exact same job. Just from doing the lower positions, the nursing assistant, then the floor nurse, then the manager of the unit. I think this gives you a better understanding of the smaller workings that help the unit flow as a whole. Okay, vertical or horizontal structure. I would prefer a vertical organizational structure as a manager because this seems to be more of a personal way to manage a staff. Since there are multiple smaller departments, you can have your own inner organizational structures to collectively attempt to accomplish the goals of the whole organization. So then you have multiple managers working with smaller groups of staff, and you're able to be there more to support and guide your staff and make sure that the daily processes are being carried out appropriately. I feel that the horizontal structure, the managers are not as available due to the increase in position demands, so they're overseeing a larger amount of staff, and there's just no way to be there for everyone on a daily basis. And I feel that in order to earn respect and trust of your staff, you need to be there and be available for them. I do like the organizational theory model because it seems more organized, just to me personally, and it can help the manager better predict the effect of a change on the organization as a whole. And I like predictability. I like to be able to assess the outcomes of certain changes if they were made, or better predict them. That's about it for my block 3. Thank you for listening.